Good morning and welcome to Radio Friends on Thursday, August the 29th. My friend Anand, Dr. Anand Chockalingam is with us from MU Healthcare. Good to have you here, Doctor.
Pleasure is mine, as always.
Yeah, normally when you come, you're in a coat and tie, but today you're in your scrubs.
Yes, today I had to rush to make my appointment with you.
You did. You were finishing up a procedure, and we were going to talk about something else, but you were telling me about this procedure that you were doing. I found this really interesting. You were doing a ultrasound of the heart by going down through the esophagus, right? Mm-hmm. Why?
We call it a transesophageal echocardiogram, TEE. It's like any ultrasound or any other echocardiogram. It's just that we can get much clearer pictures of the heart function and the valves and everything else when we are right behind the heart in the esophagus.
So instead of doing it from the outside, mm-hmm. you're going down inside the body and getting an ultrasound picture of the heart. What are you seeing when you do that?
Most heart questions like the heart squeeze and whether the patient is having a heart attack or any valve disease or fluid around the heart, most of these questions we are able to answer with a regular ultrasound. But this transesophageal ultrasound or echo, TEE, gives us much clearer pictures when we want to know for sure if there is any small infection in the heart or to understand the mechanism why a valve is leaking. And today, the reason I had to do it was in a patient who was admitted to our hospital after suffering from a small stroke. So the neurologist wanted to know for sure if there is any clot inside the heart or if there is any small holes that we call patent foramen ovale or small holes in the atrium that we could see clearly with the transesophageal echo and then make further treatment plans. We can plug it percutaneously. So these things are all evolving. We have new treatments. So to get a better picture of the heart and make sure it's not contributing to the brain symptoms, we wanted to do this.
So did everything come out okay?
Oh yeah, it went okay. It took a little longer sometimes.
Yes. And we didn't mind waiting for you for that. But the thing that I find fascinating, the patient is awake when you're doing this procedure and you're putting this down the esophagus. This doesn't hurt.
We've been doing this for 20 years and pretty safe. We don't have too many concerns, except it's a little uncomfortable. So we give them sedation. So I wouldn't say it's a surgery. I would say it's a semi-invasive procedure. So we give sedation. People are a little sleepy, comfortable. We ask them to think about pleasant places like being in Hawaii.
Yeah.
And then we get them to swallow the probe. That's the easiest way to do it.
You have to swallow the probe?
After that, it takes us 5-10 minutes to take these quick pictures around the heart. And then
you take a quick trip around the heart, and then you take the probe out.
Yeah.
Do they have to spit the probe up, or do you pull it?
No, we just pull it out.
You did, okay. And it's amazing the progress that is being made, and you're able to see as if you're looking at it right there.
Yeah. Next time I'll get you some pictures.
Yeah. When you talk about the heart, it's an amazing machine in our body, isn't it?
It is.
We abuse our heart from time to time by not taking care of it properly.
Did I hear all the time or most of the time?
Do we abuse it all the time?
I wish we don't, but we do a lot. We take it for granted because the heart has been pumping for us from before the time we are born until our last breath. And we sort of assume it's going to do its job, and that can get us in trouble. So if we pay a little more attention to our heart and to our health, I think it will do so much better for us.
How can we pay more attention to our heart?
You were asking about the coming change in seasons.
Yeah.
We are coming to the end of summer. So the next few months is going to be beautiful in Colombia. So I'm inviting all our friends to come spend more time in the open spaces that we have,
outside.
The trails. It's going to be beautiful fall weather. So make it a point to go and enjoy nature, but also get the exercise that we all need. 30 minutes most days of the week. Some exercise. Most important thing about the exercise is that you like it.
And walking is a wonderful form of exercise, right? We were talking one of your earlier segments about just the fact of how important it is to be outside, to go outside. There's something special that's beneficial to the body being outside, correct?
Exercise is wonderful. That has a whole set of benefits that we don't have to club with this discussion. If we talk about the benefits of just being outside in nature, that has a separate set of benefits.
Okay, the exercise has one set of benefits, but just being outside in nature has a whole another set of benefits.
Definitely.
And what are they?
In this beautiful weather, if we go outside, being in the sun itself directly elevates our mood, the type of chemicals that the brain secretes. So being outdoors in the sunshine is a great thing. Being out in nature with trees and flowers and plants and just being out there gives us a way to connect with our original roots.
That's
we are all
true,
part
it
of
is.
nature.
Yes,
The
yes.
reason we live indoors is because we want to accomplish other things. But if you go back to our origins, we are all still part of nature. So being outdoors gives our body so many benefits as far as controlling stress, controlling blood pressure, improving our control of diabetes
Just being
and other
outdoor-
things.
being
All
outdoors?
these things will indirectly help us connect and improve our health, reduce the requirement for medications from so many fronts. Looking at it holistically, spending time in nature is wonderful. Exercising is wonderful. If you want to combine them both, you get
Yeah.
double bang for the buck.
Yeah. So go outside and exercise. Go outside and just, even if you just go outside and read a book or you stroll through the woods, you're getting the benefits of exercise and you're getting the benefits of what nature has to offer all of us.
Definitely.
Yeah. Okay. So we know what to do to make our heart better and good. Stay away from smoking also.
Yes.
Would you say
For
that's
sure, for
the number
sure.
one thing, smoking?
Unfortunately, it remains still the biggest problem and challenge for us. So when I see my patients, I tell them, putting your family doctor, cardiologist, heart surgeon, the balloons, the stents, the surgeries, everything on one side. Still, the cigarette will find a way through and get to your heart.
Okay.
So that's the reality.
Yeah.
We have to quit cigarette. The sooner we do, the better for us. And it still takes 3 to 5 years for the body to clear the last bit of cigarette from it. It takes so long.
It takes 3 to 5
Yeah,
years.
yeah. If you quit in 2019, by 2024, good chance your body won't have any more of that last cigarette left in you.
Is that right?
It's that serious.
Doctor, you're an amazing person to talk to. I appreciate you coming out today. I'm glad that the procedure went well. That held you up just a bit. We're glad that you're here.
I'm so happy
All
to
right?
meet you.
It's
Enjoy the
peop-
summer.
Yeah, right. You got to be somewhere. I'm glad you're here. If you want more information, you can go to muhealth.org. Dr. Anand Chockalingam. Come back again, will you?
Thank you.
We're out of time for today. PepperPMissouri.edu. Like something here or see. Bye-bye.